most common patient complaints? Well, if you've ever been on the receiving end, you probably know that most are about administrative parts of a hospital or clinic. For instance, how often have you heard complaints about difficulties in reaching a staff member on the phone, or how an appointment never starts on time? If you're an administrator, you may have tried quick fixes such as have more people on the phones, more staff training, online pre-registration and new patient paperwork, or asking patients to arrive for their appointments 15 to 20 minutes early. But in my experience, even after enacting these solutions, patient complaints usually don't change. The reason? Administrators didn't address the right issue in the first place. Without more information, patient complaints can actually lead us away from the real underlying problem. And sometimes, without even knowing it, we make up stories to understand the patient's experience. For example, our knee-jerk reaction to phone complaints is just put more people on the phone. But more isn't always the solution. Instead, it's important to first collect the data about possible causes. Let's walk through an example of why solutions based on data and observations are more effective. We worked with a clinic receiving patient complaints that staff never answered the phone calls or responded to voicemails. If someone did call a patient back, it wasn't until several days later. To give some context, this clinic had about 30 available appointment slots a day, 15 administrative non-management staff. They ran about at 65% capacity and had a cancellation rate less than 5%. We took a look at the clinic's internal data, and here's what we found. 75% of the incoming calls were transferred to other associates. The call abandonment rate was greater than 20%, in contrast to general standards of it being less than 5%. Call volume was about 800 calls per week, with a steady daily increase through the week. We also observed the staff at work to see if any behaviors or processes contributing to the problems. Our observations revealed that first, a majority of calls were for new or follow-up appointments, not clinical questions. Associates were given out their direct numbers for patients to circumvent the phone system. People would call the clinic multiple times a day. There was no process for returning calls left in a certain voicemail queue. Each provider had one administrative person responsible for scheduling all of that doctor's appointments and surgeries. All administrative associates, no matter title, job description, or tasking, were required to be logged on and answering phone calls while they were in the office. The difference in the type of appointments being scheduled were also minimal. These observations and data revealed several issues. First, when a patient called the clinic, the likelihood of reaching someone assigned to the patient's doctor was small, hence the high transfer rate. If the patient did reach the right staff member, the likelihood was small that the staffer wasn't on the phone with another patient, creating a high volume and a high abandonment rate. Second, when the patient called a staffer on the direct line, more often than not, the staff member logged off the phone system to answer because they knew it was a patient under the staffer's care. This habit was a breach of established standards and process. And lastly, since most patients weren't able to reach the right person on the first try, patients subsequently called the clinic multiple times a day to make appointments, increasing the phone call volume by 50 to 75%. Now you can understand why merely adding more staff wouldn't fix the problem. The real issue was not staff capacity, but getting the patient to the right person on the first call. As soon as we identified the pain point, the clinic created an action plan. They decided to create a mini phone center with only 3 associates to schedule all appointments. Doctors were still able to keep their point person, but this person no longer managed appointment scheduling. All these changes required was a rearrangement of job tasks. The clinic made no changes to staff job titles or pay ranges, and the clinic did not hire more staff. In the first week following the changes, call volume fell by almost 60%. The call abandonment rate decreased to less than 10%. The clinic suddenly had more capacity for new physicians coming into the practice. Over the next few weeks, patients noted the ease of the improved scheduling process. Customer feedback and comments are very important to the success of any business. But if you try to band-aid each symptom, you will never truly solve anything, and the disease will continue to grow. Look for data aligned with observations to drive how to put in place effective, productive solutions the first time.